just gonna start. Hi, I'm Erica, and this is my channel. It's called The Bee's Knees. Why this name? It's kind of twofold, and I'm going to be referring to my notes so I stay on track with this upload. Well, obviously it's about knees, but I also do say the bee's knees quite a bit, actually, when I'm talking about things I like or things that are great. So hopefully this knee replacement that I'm getting is going to be the bee's knees. So why did I start this channel? Why are you even clicking on this video? Because I'm getting a total knee replacement on April 10th. And when I started researching this process, I realized that there isn't a ton of content for individuals or people who are under the age of 50 going through this surgery and this recovery, especially people like me who live alone, who live solo, and you're preparing to recover on your own. I have personally recovered from several surgeries on my own, living alone. I've lived alone since, 2011. And so I've had 2 major cervical spine surgeries during that time, and it was during COVID. I've had multiple knee injuries, a major surgery on my right knee. And again, lived alone. I've lived in different places with stairs, places without stairs. I have cats, so not technically fully alone. Really, that's why I've decided to document this experience. I am not here to give medical advice. I'm not a doctor. I'm not in the medical field at all. I am simply sharing my experience, what has worked for me, what hasn't worked for me, what I'm planning to do. And I know that everyone's situation is different and nothing about this process is perfect. It is fluid. But why am I documenting this is another aspect I want to cover, because right now the surgery and everything about it is kind of an obsession. So I find myself researching it, second guessing myself and getting the surgery, worrying about it, trying to prepare as best as I can for what's in front of me. So instead of boring my friends, my loved ones, coworkers with all the endless details about my knees, which they've all lived through and experienced right along with me, I thought I would put it on YouTube, and the hopes that it may actually hit somebody that is in the same boat, looking for, I don't know, someone to share the experience with. I like that phrase, trust one who has gone through it. And I don't know who said that, but maybe Abraham Lincoln. Anyway, I'll look it up. So this channel is really just an outlet for me to talk through and work through this experience. So let's chat through my knee history. My knee issues stem from birth. I have congenital deformity called trochlear dysplasia. My first surgery was as an infant, and I know there's a photo of me somewhere as a baby with casts on both legs. I can see it in my mind. If I find it, I'll stick it in here for you guys to see. So, but the first surgery I remember was on my left knee, and I was in 3rd grade, and it was a lateral release. So I do remember that. And then when I was 11 years old, I think that's like maybe 6th grade, I was told that I would likely need a full knee replacement or a total knee reconstruction on my right knee by the time I was 40. And then I proceeded to have a knee surgery on my right knee when I was 12. That was a lateral release. I then had another surgery when I was 21 on the right knee again. I had a lateral release with reefing, where they take cadaver tissue and basically make an anchor for your kneecap to help hold it in joint, because that's really where I'm at right now, is that through all of these surgeries, all of these Oh, and then I had another, sorry, and then I had another surgery. I think I was around 40. I'm 49 right now. I had a full dislocation of my right knee. So, and that was also another surgery. So, which was a lateral release with a synovectomy. So taking out some of that nasty synovial fluid and synovial, I think, lining as well. Trying to remember off the top of my head. And then where we are today. So you fast forward during this time, this past year, less than a year, I've had 2 pretty significant falls where my patella sublux dislocated. And then I also had a hemathromsis. So that is the, I would say it's like a hematoma when it's in the joint. So the blood is all in the joint, and then it swells to like a cantaloupe, and then you get the fluid removed, and I had about 50 cc's of fluid removed in December, and I didn't even do anything to my knee. And then in January, I tripped and hurt my ribs quite badly. Of course, hurt my knee. I was already in physical therapy for my knee, and so that's where I'm at right now. Over time, the knee just degenerates, right? So when you have surgery, anytime I've had cortisone, lidocaine shots, all of that. But that really doesn't solve the issue of the stability. So in addition to the trochlear dysplasia that I have, the subluxing patellas, I also now have developed tricompartmental osteoarthritis. So basically I have arthritis in the entirety of the joint. And so from there's really nothing left to do. And to put it mildly, part of my trepidation of knee replacement surgery, even though I want it, I do. I honestly don't know what life is like with like normal knees. This is all I know. And so having a bad knee that does this is, even though it's erratic and I don't always know when it's going to happen, it's a devil I know, and a knee replacement and a new joint is a devil that I don't know. So, and that's scary for me, because as I sit here, I don't have pain. I just don't have any stability. So not being able to trust the joint isn't allowing me to live a quality of life that I would like to live going into the next decade of my life. So with that, I'm not quite 50, and that's a concern. However, you realize when you get passed from surgeon to surgeon to surgeon, eventually they say, you know what, it's time. And they no longer look at age. It is, does the joint function and the quality of life? So I can certainly talk about my surgeon experiences, which have all been so amazing. I have lovely surgeons. They all just keep sending me to another surgeon who they feel is smarter than them, because I'm a complex case. Another aspect of my situation that I feel can help people is that I live alone. So I live solo, as you know, but I have 2 cats. I have 10-year-old ragdolls. I love them to death. So preparing for surgery and recovering afterwards will involve doing a lot of this on my own. And like I said, I've lived alone through other major surgeries. Many people go through medical procedures while living independently, but I don't think it's talked about very much. And so part of this channel will document what recovery looks like when you're doing it solo. So as the channel develops, I plan on sharing tips and tricks that have helped me in the past and are helping me now, and products that I currently use, and then products that also didn't work for me because I have been through a lot. And then products I plan to use during recovery, so things I've never had that I did grab off of Amazon or other places. And some of these might turn out to just be the bee's knees, and I want to share with you all of what I'm doing. To give you an idea of what that might look like, I use red light therapy. I have ice machines, or I've had ice machines. I have one now that I love, but I've been through a couple. I also use different topical creams. I use different types of K-tape, kinesiology tape. One is my favorite though. And then I also think about wound care. So which I'll show in more videos, in upcoming videos. I already have a 7-8 inch scar on my knee. And another concern is having enough skin to do this surgery. And then subsequently from there, when I need another knee replacement 20 years down the road, I don't have enough skin then. So, and that's part of why surgeons really want to go, they advise against or waiting as long as possible to have a knee replacement, because you're going to need it again. A revision is what they call it. So, but I'd rather that's fine when I'm 70. I'll just be, not with these cats, but with other cats, probably just sitting in an apartment. But right now I want to live normal life and just be able to ambulate around and not fall. So I don't know what life is like that, without having somebody help you spot obstacles in your way, not looking down for every step, which causes another whole level of anxiety. So let's close out this video. My surgery is April 10th. And so again, we're going to document prep, surgery and recovery, wound care as well. And if you're going through something similar, I'd love to hear from you. You're welcome to follow along. I'd love your tips and tricks and what's worked for you also, as we're all kind of going through this process together. And that is the beginning of the bee's knees. Thanks. And thanks for watching.